Welcome to Global Products MURx Ophthalmology EHR. This is the login page of the EHR. We'll log in using a test facility, which takes us to the main dashboard. These panels are shortcuts to the frequently used modules or parts of the software. There's a detailed navigation menu on the left hand side. The ophthalmology OPD page can be accessed using this patient to consult shortcut panel. Click on patient to consult. It shows the name of the patient. Clicking on the name of the patient will open the clinical management module of the EHR. The topmost part displays the patient details. Next, the patient medical and social history can be recorded by clicking on add update. The relevant selections can be made by just clicking on the checkbox for the option and click on save. The medical history or the selected record will be displayed. Next, coming to the ophthalmology examinations, click on add update. The left hand column shows the list of examinations and the right hand column the findings for the examinations. So if we click on vision, it shows the findings for vision in the right hand column. Again, for the right eye and the left eye, selections are to be made, can be made by just clicking on the check boxes and clicking on save. All of these selections for the particular visit for the patient will be displayed under the examination. Now the examination sequence can be changed as per the requirement by the doctor by double clicking on the name of the examination, which opens up a small dialog box. There's a sequence number which can be entered and the examination name is displayed by default and it can be saved. So the sequence of the examinations can be changed by the doctors according to their requirement. They can customize it. Next, coming to diagnosis, MURx has a list of all ICD-10 codes. To record a diagnosis, click on add, which opens up a new window for diagnosis. There are two parts. One is the ICD-10 codes diagnosis. The selection is by default, and the other is for recording diagnosis if there are any which have not been covered in the ICD-10 codes. So coming back to the ICD-10 codes, entering the name of the diagnosis shows a list of all the diagnoses for cataract with their ICD-10 codes. Similarly for retina. Glaucoma. By tapping in name, the required diagnosis can be selected and the onset date can be recorded. When we click on save, the diagnosis along with the ICD-10 codes is displayed under diagnosis. Current medication if any taken by the patient can be recorded by typing into this free text box. Coming to the prescription part, medicines can be prescribed from within the software using the drug database in MURx. So click on add. The medicine or drug can be searched using the medicine advanced search function by brand name, generic name, or both, and by the category of the drug. This category of drug can be added, or the category already present can be modified. To add, type in the category of drug, and click on add. The category will get added. If it is to be modified, select the category and type in the name, click on modify, and the category will get modified. Clicking on save, the category will be saved. And to select the drug or medicine, enter the name, select the drug from the list, then the dose, drops, the frequency, the number of days for which the medicine is to be given, and click on save. So this drop medicine gets added to the list. Once a medicine is selected for a particular diagnosis, it gets added to a default prescription which is generated in this MURx ophthalmology EHR. So whenever during the next visit, when senile cataract is selected or saved or specified as the diagnosis, the default prescription or the drugs selected will show in the prescription as a default prescription. The doctor can select the default prescription, or he can add the medicine or drug as shown before. Now this prescription is editable. The dosage, quantity, frequency, and the number of days or the duration can be edited. For saving, to edit the prescription for any of these headings such as quantity, dosage, frequency, and duration, click on the name of the drug and the dosage, say for example, can be changed, and the number of days. Click on save. And the prescription gets edited. Again, clicking on save. A prescription can be generated from within the software by selecting print prescription, and the prescription can be printed out on the letterhead. Next, coming to the glass details. To record glass details for spectacles for either distance or near, click on distance. It will open up the chart with all the readings. Selecting the values for spherical, cylindrical axis, and visual acuity for the right eye, and then for the left eye. Click on save and the readings will be displayed. Prism readings can be entered or selected by clicking on the prism, and the readings just need to be selected. And save. The IPD values for prism also can be selected from the chart. The glass type can be selected. The glass type again can be added by clicking on this green button, and the type of glass can be added, or the existing can be modified by selecting. Similarly, the glass material, if any, special instructions can be added or modified. The glass use type, for reading constant, again addition or modification can be done. And finally is the glass coating. And coming to clinical vision, click on add update. It opens up the chart for clinical vision for right eye and left eye. Again, the values need not be entered, they can be selected from this chart and saved. Next is the auto refractometer readings. Click on add and select the values, saving upon time, and save. The advice, if any, can be added or updated for the patient. The next visit date and a reminder date can be set from the calendar options. This is the ophthalmology OPD page, wherein the all the patient readings or data, clinical data, can be saved and displayed in this single screen. Next are the subspecialties such as cornea, cornea follow-up, injury, retina, keratoplasty, glaucoma, and pediatrics. Starting with cornea, history of presenting illness can be entered using free text format. The examinations can be selected. Image can be edited or marked up by using the built-in image editor in MURx. By clicking on the image, it opens up the image editor, which can be marked up as required, and then save. Will display it in this page. Intraocular pressure, operative details with the date, differential diagnosis if any, keratometry, manual auto K, topography, specular microscopy, anterior segment, pachymetry, conjunctival swab, corneal scrape, treatment, all can be entered in free text format for cornea subspecialty. And coming to the injury subspecialty, details for any eye injury can be entered in free text format under the injury subspecialty. So it's classification: closed globe injury, open globe injury, the ocular trauma score, Roper Hall classification. Next is the retina subspecialty, color vision, diagnosis, complete anterior segment, retina exam, injection numbers, keratoplasty, subspecialty, axial and retinoscopy AR, intraocular pressure using Shiort's eye care applanation digital, the operative details such as preserved medium, donor details, culture and sensitivity. Next is the glaucoma subspecialty, the medications. The image can be edited. Using the image editor, and other details such as IOP, central corneal thickness, fundus examinations, OCT, perimetry details can be entered. And then the last is pediatric, complaints, headaches, squinting of eyes, the birth history, color vision, facial symmetry, squint motor assessment. All these informations can be added. So this is the MURx ophthalmology EHR for general ophthalmology and subspecialty. Reports required, if any, can be generated from within the software, such as for specific diagnosis or specific patient medication list. A bill receipt can also be generated by selecting super bill in the navigation menu. The names of the patients for the day are displayed by clicking on the names. It shows a sample bill receipt which can be printed and given to the patient. So this is the MURx ophthalmology EHR from Global Products.